video is on Attention Deficit Hyperactivity Disorder, also known as ADHD. So this is a chronic condition which affects millions of children and often continues into adulthood. So it includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity and impulsive behaviour. So children who have got ADHD can struggle with low esteem, troubled relationships and poor performance in school. Symptoms sometimes lessen with age, however some people actually never outgrow their ADHD symptoms, but there are strategies that can make it successful. There isn't any treatment to cure this, but it can help with the symptoms a lot. Treatment involves medications and behavioural interventions. Early diagnosis and treatment can make a big difference in outcomes. So the primary features of ADHD include attention and hyperactive impulsive behaviour. So these start before the age 12, and in some children they're noticeable as early as 3 years age. These symptoms can be mild, moderate or severe and can continue into adulthood. ADHD often occurs in more males than females, and behaviours can be different in boys and girls. So boys are more likely to be hyperactive and girls can tend to be quietly inattentive. So there are three subtypes. So there's predominantly inattentive. So the majority of symptoms fall under this one. Then you have predominantly hyperactive impulsive. So the majority of symptoms are hyperactive and impulsive. And then you have combined. This is a mix of inattentive symptoms and hyperactive impulsive symptoms. So a child who shows a pattern of inattention can often fail to pay close attention to detail or make careless mistakes in schoolwork, have trouble staying focused in tasks or play, appear not to listen, have difficulty following through on instructions and failure to finish schoolwork or chores, have trouble organising tasks and activities, avoid or dislike tasks that require focused mental effort such as homework, lose items needed for tasks or activities, school assignments, pencils, be easily distracted and forget to do your daily chores. So other symptoms as well include talking too much, having trouble playing or doing activity quietly, blotting out answers, running around in situations not appropriate, beyond the goal and constant motion, uh, interrupting others or other conversations, games or activities. So as I said previously, those are symptoms for hyperactivity and impulsivity. So fidgeting with tapping his or hands feet or squirming in the seat, difficulty staying in the classroom or other situations, being on the go in constant motion, running around in situations when not appropriate, having trouble playing or doing activity quietly, talking too much, blotting out answers, interrupting a question, or having difficulty waiting for his or her turn, and then interrupting others. So the causes of ADHD are not clear, but efforts do continue. There are factors that can include genetics, the environment, or problems within the central nervous system at key moments. So risk factors include blood relatives who have got ADHD or another mental health disorder, exposure to environmental toxins such as lead found mainly in paint and pipe and other older buildings, drug use, maternal alcohol use or smoking during pregnancy, premature birth, and sugar has been suspected, but there's not much evidence for this. So ADHD doesn't often cause psychological developmental problems. However, children with ADHD are more likely than others to have conditions such as oppositional defiant disorder, which is defined as a pattern of negative, defiant, hostile behaviour towards authority figures. Chronic disorder marked by antisocial behaviour such as stealing, fighting, destroying property and harming people or animals. Destructive mood regulation disorder, which is characterised by irritability and problems tolerating frustration. Learning disabilities include problems with reading, writing, understanding, and communicating. Substance use disorders, including drugs, alcohol, and smoking. Anxiety disorders, which include depression, bipolar, including manic behaviour. And you can also get autism spectrum disorder, which is related to brain development that impacts how a person perceives and socialises with others. There's also Tourette syndrome or tic disorder, which involves repetitive movements or unwanted sounds that can't easily be controlled. To help reduce your risks of ADHD, so during pregnancy, don't take any drugs. Maternal drug use is your problem. Protect your child from exposure to pollutant and toxins such as lead and environmental pollutants, and limit screen time. So these days we've got this issue with the tabs and all that, and the phones, children on it. Try and limit that as much as possible. For diagnosis, this can be difficult in young children due to developmental problems such as language delays, which can be mistaken for ADHD. So you have a evaluation by a psychologist, a psychiatrist, or a speech therapist. and there are a number of conditions that resemble ADHD. So a medical exam is undertaken. So this is like to look for learning and language problems, mood disorders, depression, anxiety, seizure disorders, autism, to try and rule it out before it comes to ADHD. And there's also interviews or questionnaires for family members, people who know your child, caregivers, babysitters, coaches. And there's also the ADHD criteria and ADHD rating scales. So standard treatments include medications, behaviour therapy, counselling, and education services. These can relieve the symptoms but they don't cure. So there are stimulant medications known as psychostimulants, which are most commonly prescribed medication for ADHD. These appear to boost and balance levels of brain chemical neurotransmitters. These medications help improve the signs and symptoms of inattention hyperactivity. And examples include amphetamines, which include dextroamphetamine, amphetamine, and lisdexamfetamine. Then there's methylphenidates, demethylphenidates, also known as Fortalin. There's also stimulant drugs that are available in short-acting or long-acting forms, and these are variants that are available to one on the hip. So the right dose varies from child to child, so it can take some time to find the correct dose, and the dose needs to be adjusted if significant side effects occur as your child matures. There are stimulant medications as well. So this can be concerns. So the stimulant medication before, as above, as I mentioned, psychostimulants. So these can increase the results of heart problems. So you can have increased blood pressure as a result, and you will get monitored for a family history of heart disease and to see if there's any heart conditions as a result of this use. Psychiatric problems as well, but it's very rare. So you can get agitated or psychotic or manic episodes. And other medications can also be effective in treatment, including atomoxetine, antidepressants such as bupropion, wellbutrin, guanfacine, clonidine. But these work slower than stimulants and can take several weeks before they take full effects. So these are a good option if your child are unable to take the stimulants, the psychostimulants, especially because of health problems or if they cause severe side effects. That's the end of today's video. I hope you've had fun listening to this and tune in for the next one.